E-learning's boring, and I didn't want to make something that was boring. Solutions 42 is a performance and productivity improvement organisation, and what that means is that we connect management with the systems and processes of operation and the fundamental important aspect of people. The problem that we were trying to solve was, how do we improve cleaning practices which also improves infection prevention control precautions, standard precautions in the environment? How do we marry those two things together to help people take the right action at the right time? If we just keep doing tick box exercise training, which is what is currently happening with infection prevention control, then we don't get this marriage and we don't get this integration between, it's a whole approach, a whole system approach. Spotless is it's a digital learning program that's basically been designed in a scenario format. So we're contextualizing different scenes that you might come across in this instance, a care home environment. And we're integrating infection prevention control principles with the cleaning aspect, but in the environment and also by the job role. So if you are a cleaner, then you will be presented with a scene that is there to challenge your thinking around how do we manage that particular cleaning aspect and how does that tie up with infection prevention control. And it's very different from what is currently out there in terms of e-learning around infection prevention control stuff, because it's actually set as a scene in that environment. And one of the feedbacks that we got from the work that we've done with care homes is that e-learning's boring, and I didn't want to make something that was boring. I wanted to make something that was going to grab people's attention, that was going to break the mold, if you like, of what I call tick box training, where you get given a video or you get given a PowerPoint presentation, and then at the end of it you have to do a multiple choice questionnaire. I wanted to break that mold, because that isn't really helping the person on the ground learn. It's testing their short-term memory, but it's not actually helping them to develop the skills that are required for their particular job role. In a healthcare environment, whether that's a hospital or a care home, it's always extraordinarily busy. There's usually a lack of time that is allocated towards learning, other than doing the mandatory subjects. And so you find there is a mix across the board of requests for people to either do the learning in work time or do the learning in their own time. And what you find is that some people obviously prefer to do it in their own time because they cannot fit it during their normal day. So in the thinking and the design behind Spotless, it was important to provide something that would be accessible anywhere. So if I'm traveling and I'm in the car with somebody because we've got to travel to another facility and because we've got told we've got to do something over another facility, at least I could possibly access it on my mobile phone or access it on my tablet. Or, okay, I'm actually in a workplace and I need to do it on the desktop. So this is some of the things that we had to think about when we were designing it. And yeah, it was important, if you're going to get people in a remote situation doing it from home, that it needed to be something that would engage them, that would be meaningful, memorable and motivational. Spotless is fun, it's bright, colourful, And so if you have registered as your particular job role, which might be, in this case, a cleaner, you are presented with you got a scene, a picture of you basically in first person. So you will see, you have to imagine that you are that person in that scene. So the first thing that you'll get presented with is you've come on your shift today and you've picked up your cleaning trolley, and you then receive a call, or the supervisor comes along and says dramatically to you that Doris has vomited in the dining room, and you're then presented with, what do you do next? So if a participant actually gets every single choice wrong, then the outcome is catastrophic. And what do I mean by catastrophic? Well, not only is there a high proportion of more than 50% of the home, in this case, would be sick. The home would be absolutely closed, no visitors, nothing like that, and there would be a death. So we've made it quite engaging, because it's not nice to talk about death, but that death does happen when we get it wrong. And so we have actually made it quite engaging by taking some inspiration from crime scene investigations, where they do the little white outline of a body. So hopefully that, it brings a bit of smile to the face, but at the same time it brings it home that if we don't get the practices right, we can actually cause quite serious harm.